he is in quarantine. All of those things have yet to be determined.
Early morning, October 2nd.
What the president wants at this moment. There are certain things that, certain protocol that have to be followed here. Our Caitlin Collins has been following this story from Washington, D.C. I'm not sure, do we have Samantha Vinograd who is with us as well? Samantha Vinograd is our security correspondent who has been briefing us on what happens at this moment. Do we have Samantha with us, yes or no? So we don't have Samantha. We'll go back to Caitlin. Caitlin, so listen, the president's physician says that the president will continue his duties without disruption while recovering, but we don't know if that's absolutely sure now, if that's absolutely possible. We don't know the president's condition. I would assume, since he gave an interview this evening, that he feels fine. He didn't mention that he felt sick, but who knows what is going to happen and what his condition will be while he is in quarantine and while this virus progresses in his body.
That's the #1 question, is the president's health. I do not think that any other sitting president in office has faced something this serious in decades. I mean, it's hard to think. You know, you think of heart attacks, you think of other issues. Obviously, Ronald Reagan being shot, things of that nature come to mind when you think of the president having something that is so serious and also so unknown, Dawn. That there are still a lot of unknowns about coronavirus, where we see how it affects some people severely, some people not at all. Sometimes it depends on their age, their comorbidities, but it really is unpredictable at best. And that's why health experts have been so concerned about it and said, you know, it's not just the people who are young that don't have anything to worry about, that can go back to work, that can do this. The fear is that they would spread it to other people, people who are older, like the president who is in his 70s and do have comorbidities. And so while now they do say the president is feeling well, that is obviously great news. This is going to be a massive threat facing the White House to just see how the president does fare with this. It's not known. We have no idea how this will end up, and it is just remarkable that this is a place that we have gotten to, especially on a day where the president was at this indoor fundraiser earlier. He had a pre-recorded remarks for a dinner, and in those he said that the end of the pandemic was in sight. He was talking in these hopeful terms that we have heard the president use so often to describe what's facing the country, and now the president himself and the First Lady have been diagnosed, and that is a worst case scenario. I cannot stress it enough. For everyone who works in the White House, people who work in the Pentagon, everyone who works throughout this administration, it's a worst case scenario. And so what they do going forward and how this changes the structure of the president and the vice president who met with the president and was in the Oval Office on Tuesday, and other senior staffers inside the White House who interacted closely with now 3 people who have coronavirus, President Trump and Hope Hicks. The First Lady, to some extent, she's not in the West Wing as much, but now there are 2 people in the West Wing who had coronavirus, and we're meeting with all of these other senior officials, the upper echelons of government, that now is going to be a massive concern.
We also have the former Vice President of the United States, who is now running for president to take Donald Trump's job, in contact. I'm not sure how closely they were on the same stage together, you know, speaking in loud tones to each other, projecting, and we know that's how the droplets spread. I want you to stand by. We also have Brian Salter standing by. He's watching the Dow futures that are plunging right now, and he can do that. But I want to get to our chief medical correspondent, Dr. Sanjay Gupta. Doctor, thank you very much for joining us and helping us get through this. Here it is at 1:23 in the morning, 1:23 a.m. We're learning that the President of the United States has tested positive. He's 74 years old. He is obese. How great of a risk is it to someone of his age and with his health background?
Well, this is one of the great concerns, and you know, we're obviously all hoping he and the First Lady don't develop much in the way of symptoms, and you know, statistically, still, the statistics are on people's side, even at that age. But this is of great concern. He is a vulnerable person because of his age, because of pre-existing conditions, and this is the sort of thing that you know, medical team is going to have to obviously be watching out for, to see if he does develop symptoms, how quickly any symptoms might start to occur, and then what to do about it. So it's tough to put an exact number on it. We do know, of course, who is going to be more vulnerable and who is not, and I don't know, Don, just sort of read that memorandum for Dr. Conley. It doesn't sound like President Trump has had any symptoms. This is all based on surveillance testing that came back. Is that right?
This is all, I'm not sure of the type of testing that came back, but because of the memorandum doesn't really say, Sanjay, I'm sure if you guys are in the control, Zach, can you email the memorandum to Sanjay so we can look at it? It doesn't say what kind of testing, it just says he tested positive for SARS CoV-2 virus. That's all it said.
Well, we know that he's been tested on a I believe, daily basis. So this is more of sort of surveillance testing. We know that there's been, obviously, as Caitlin has pointed out, people within the West Wing that have tested positive. So, you know, I got to tell you, I'm not surprised, Don, at this. It's obviously unsettling, but I'm not surprised given the contagiousness of this virus and what have been the lax protocols. You know, surprisingly, stunningly, shockingly lax protocols within the West Wing, a small confined space, people who are infected, not wearing masks, even if they're being tested on a daily or regular basis. Testing doesn't prevent one from getting the virus. That just lets you know after you've developed it, been infected with it. So it's tough news to hear, and obviously, again, as I mentioned, he is considered a vulnerable patient by virtue of age and pre-existing illness, so this is something that doctors, I'm sure, in the West Wing are going to be watching out for. Now, even before the president was diagnosed, when Hope Hicks was diagnosed, at that point, given her proximity to the president, protocol would argue from the Centers for Disease Control that the president would need to be quarantined at that point, given his proximity. Now, for certain, he's going to need to be isolated, as I'm sure is in the memorandum as well. He's going to need to recover at home, have symptoms monitored, and if he develops symptoms, he may need to go to the hospital.
Let me just take a moment here, Doctor, and this is horrible for the President, for the First Lady, for Hope Hicks, and for anyone who came in contact with them and are possibly positive for the coronavirus as well. As we know from our colleagues, some of our colleagues here who have tested positive, it is not an easy thing. It affects many people in different ways, but it can, obviously we know, be deadly. 207,000 people have died from coronavirus. So listen, we hope the President gets through this. We hope the First Lady gets through this, and Hope Hicks as well. But it is also, Sanjay, an awful thing for this country. The leader of the free world has now tested positive for coronavirus, and we don't know. Maybe now he is feeling well, but we just don't know. There are so many unknowns at the moment.
Yeah, there really are. And, as you're pointing out, Don, people will immediately start looking at all the data, right? What is the data going to suggest based on the number of people who have contracted this infection, the millions of people here in the United States and around the world? But every individual is every individual, right, in terms of how they're going to respond to this. There are many people who are older who do just fine still, even though they are considered the vulnerable population. So it's tough to speculate in terms of, what the course is, the medical course, the overall course that he's going to have and the First Lady is going to have going forward. But look, this is unsettling if people are hearing this for the first time, but it is something that, was not entirely unexpected. People have kept saying, look, we are sort of through this. People haven't gotten it by now. They're not going to get it. When you talk to people who follow the course of these pandemics, we're still very much in the, second or third inning of this. So it's one of these things where in the earlier days, the fact that the President of the United States has now contracted this disease is something that, you do have to think in the back of your mind, we could have prevented things like this from happening, but not surprising. On the other hand, given the contagiousness of this and that there were several people now within the West Wing that the President had regular contact with that had this disease.
Yeah, look.
Worked for about To have your expertise and your calm, and I speak on behalf of the national audience watching this story right now. Thank you. Andrea Mitchell is our veteran chief foreign affairs correspondent. Of course, the host each day of Andrea Mitchell Reports on MSNBC. Andrea, none of this is about us, but I'm remembering taking over for you as White House correspondent in, what, 1995? Between us, we've seen a few things. Never anything like this. Talk about where this leaves this president, our country, and the presidential race with the whole world watching.
It's a devastating outcome for the president personally, so that is the first thing we have to think about, because no matter how asymptomatic he may be right now, and the First Lady, of course, we have to, as Dr. Gupta just pointed out, worry about his age, his other comorbidity factors. We've not had a real medical report from this president, unlike previous presidents. This is the first president we have not had a full medical report, a really transparent disclosure, and we have not had a full medical report even when he was candidate Donald Trump. Remember all the controversies over that, and the controversies over his first physician, Ronnie Jackson. So those are concerns. We really don't know what the baseline here is. And there is the foreign policy and domestic policy and the election campaign. I mean, it's a confluence of things. So we note that Boris Johnson and other leaders other heads of state have had the COVID and have survived wonderfully from it. But there is also the long-term effects, and that's another thing that is not well understood even by the scientists who are studying this disease. Match that, of course, with the president's own past history on COVID, calling it a hoax, denying it, downplaying it, the Bob Woodward reporting, all of the reporting, the conflicts with Dr. Fauci, with Dr. Redfield, the other members of the White House task force, downplaying them, listening to Scott Atlas, the radiologist who is not a public health or virologist expert and who has been largely discredited and criticized from within the task force, among the others, from all of our reporting. The disclosures, the whistleblowing report from Olivia Troy that broke first on the Washington Post and then on NBC and MSNBC, all of this information showing how much he has discredited and disputed and pressured the doctors, the experts around him, and undermined the FDA, the CDC, and the others who have tried to help the American people with their warnings, as recently as today with Hallie Jackson, Admiral Joar, saying, wear a mask, wash your hands, avoid, make sure you social distancing, avoid indoor locations. With the governor of Wisconsin just today again, and other officials there arguing that he should not come to two events that were scheduled for Saturday, with Wisconsin one of the worst hotspots right now in the country. So all of this, the trajectory of all the people who have now died, more than 200,000 people who have died, 7 million plus who have had this disease here alone in the United States. And a lot of this, of course, attributed to the handling of this by the White House and the president's skepticism early on and his continuing arguments with the public health experts. That is all wrapped up in an election campaign. As you know better than anyone, Brian, we're 33 days away from the election, 32 days, I guess. We're past midnight now. And this is about as big a domestic and international crisis as I can remember. And you refer back, I remember standing, at Bethesda Naval when the head of the National Cancer Institute announced that President Reagan had cancer, colon cancer at the time, and it was a national crisis. I remember covering the assassination attempt against President Reagan. Anytime a president of the United States is ill, obviously the 1981 assassination attempt was the worst that I've ever covered. That's a crisis for the country. We all pull together. We all hope for the very best. It becomes, especially in this day and age, and with this president, given all of his skepticism about COVID-19, Brian, and the way he's handled it, and the Tulsa rally, he again was disputing just the other day, last night. Wednesday night he was in Minnesota with no social distancing. At the debate on Tuesday night, there was, according to Monica Alba of our team, who was there as one of the pool reporters, there was an incident where someone from the Cleveland Clinic in a white lab coat approached the White House team, who had taken off their masks and while they were being seated, and tried to approach at least somebody in the party to get them to wear masks, and then backed off. So did not have an interaction with anybody, with the first family and anyone in that group. But the president and the entire first family were there, and we all saw them without masks. Certainly the president on the stage was not supposed to be wearing a mask. He and Joe Biden were not, and nor Chris Wallace, the moderator. But the people in the audience had been encouraged to wear masks even while they were seated. And there was no social distancing among the people in the president's party in that front row. So there were so many questions being asked about all the people in Minnesota who were at that rally. Obviously, it's an outdoor rally, but there were people, there were greeters at the airport, there was a lot of handshaking. And we've seen a lot of handshaking in the White House recently, at White House events, at all kinds of events with people, including the vice president and his team, all shaking hands, members of the cabinet. So very little effort to observe or even model the behavior that the public health officials have been advising. Brian?
Andrea Mitchell, covering the scope of this, answering all our questions. Thank you for your coverage and your calm at this hour.
Packs of votes, I think that's going to be something we're really going to have to look at, as we know from all of our polling, and as our colleagues have been able to travel the country and speak to his supporters. A Trump supporter is more often than not usually a diehard supporter. And we know most people going into this election have pretty much made up their mind. But this is certainly going to be something that is going to give people pause. I know Rebecca Jarvis is already reporting that stock futures have been affected on this. We know the president raves and cheers on the stock market at every chance he gets. The morning hours are going to be quite interesting to what the world looks like when we will wake up. I don't think we're going to bed tonight, but we'll see what happens.
We are definitely not going to bed tonight because, again, this is breaking news that is out. John Santucci, thank you so much. Again, President Trump has tested positive for COVID-19. Outstanding questions here because we are in uncharted territory. The questions, Trump's condition at this point, even though the First Lady did tweet out that they are feeling good. Another question, any impact to Vice President Mike Pence? Has he been tested? Who else in the president's inner circle has been impacted? Also, what happens to the remaining debates? Let's bring in senior White House correspondent Cecilia Vega right now. Cecilia, is it surprising to you? Because, yes, we know this president, and he has kind of flouted this whole thing about not wearing masks, going to these rallies. Are we surprised by this diagnosis here?
I mean, it's shocking given where we are this close to an election. In one hand, it's not shocking after the news of Hope Hicks testing positive because she is among his closest aides. They were right next to each other on that small space Marine One, the presidential helicopter. She is in the Oval Office all the time in direct contact with him. So just in terms of the logic of the way COVID spreads, it's not surprising that he caught it then. I mean, you listed those questions, Kenneth, coming into me right now. I think a huge question right now also has to do with Joe Biden. Has he been tested? Will he get tested? Will they give us the results of that test? And how close was he? I mean, we saw on that debate stage how close they were. There are real questions about his health and safety as well right now. And I keep going back to the president's age. He is 74 years old. Joe Biden is 77. Melania Trump is 50 years old. That is the age range for people typically to get COVID and get sick. We are talking about a prime group of people who are in a very vulnerable position right now in terms of their age. I keep thinking back to some of the things that the president has said. It's like the flu. Majority of people survive, that he's very healthy. You can talk about some of the treatments that he's proposed without the scientific evidence to back it up, and everything all my colleagues have been saying about being on the White House grounds and seeing very few people, if any, wear masks. And hearing the president just as recently as that debate mock Joe Biden for wearing masks with frequency. To say that this just upends everything right now, 30 some odd days out from the election is just a complete understatement. I don't think any of us have any idea what we are in store for right now. This is something we've not seen in American history.
Come in on Monday.
Right now, the Mullen Fire covers about 117,000 acres. Stadel says about...
He or she takes me to the...
Please.
Well, I was going to say, but you didn't answer how it impacted.
The health sector alone, or the SDG 3, it is...
A chance to catch what that was, Sean. Off the top of his head, couldn't remember. I know there's more, obviously, therapeutics now than there was back in, obviously, early March and April. These will help. I just wonder which of those, if any, the president has started taking. Which ones are more effective, in your opinion?
Well, I'll walk you through those, but I don't have inside information about which ones he might be taking. But of course, we know that there's there's some benefit to remdesivir, which is an antiviral drug. We know that later stages we're using a steroid, dexamethasone. There's some steroid inhalers that are being tested, but what he might be referring to is that we're really getting close to the finish line with monoclonal antibodies, with antibodies that are targeted to the spike protein on the SARS-CoV-2 virus. That's the future of therapeutics here, there's no doubt, but we're still in the early stages of testing that. That might be what he's referring to, but the standard of treatment early on is the antiviral drug remdesivir.
Okay, Dr.
That's assuming, by the way, that he were to get ill. I mean, we're going to watch, he's going to be watched, and hopefully they'll both remain asymptomatic and not get sick from this, which might very well be the case. And then we're going to watch everybody that's been in contact with him. There'll be constant testing going on.
Yeah, and I would assume, and I'm sure you would believe this as well, that every single person who has come in contact with him will be tested if they're not already woken up. As far as the testing is concerned, I know the White House does the rapid testing, but I've heard that that's not as effective as the nasal swab. But the swab takes longer to get back unless it is the more expensive one that the White House has. And correct me if I'm wrong on that.
Actually, you know, I know that personally because when I went to interview the president at the White House, I was tested with the Abbott kit, and that is the rapid test, and that is a 15-minute response. We think that that's slightly less accurate than what you just said, the PCR, the nasopharyngeal swab. That test, it doesn't take 2 to 3 days to get back. That's just the experience that a lot of people have around the country. In the case of the White House, in this situation, you can get that test back in a matter of hours. The Abbott test, 15 minutes. The test that you're talking about, the nasopharyngeal swab, the deeper swab, where you do the more extensive chemical testing, you can get that back on the rapid platform labs within 3 to 4 hours.
And how effective is that? I've heard anywhere from 40 to 60%, just, you know, numbers throwing out there. But if it's, you know, even that low of a percentage and he tested positive, obviously, I just wonder if the testing for the rapid is getting stronger or better.
So the answer to that is it depends on what your probability of having a positive result going in. So in other words, I'm much more likely to believe it now for somebody that came in close contact with the president or the first lady. If I got a negative test, I would be likely to believe it. The test is about 70% like probably. In other words, the sensitivity and specificity of that test, the more extensive one, not the Abbott, is about 70%. But in this situation, be even a little higher than that because it's somebody that you know had an exposure. And so if you got a negative test, you'd be more likely to believe it. But Ashley, you probably would do it again a couple of days later just to make sure.
All right, Dr. Mark Siegel, thanks so much for being with us tonight.
Thank you.
And now we're going to go to Shannon Bream. She is the anchor of Fox News at Night. Shannon, thanks for joining us a couple hours after your show. I know you guys were all over this during your show tonight.
Yeah, we were. And, you know, of course it makes news when anyone close to the president and his inner circle comes up with a positive test. And so after that, you heard the president, all with Sean Hannity, saying that he and the First Lady are awaiting their test results. I've done the rapid test over at the White House and had results, you know, within 10, 15 minutes. So I knew that they had access, of course, to the best of the best and the quickest of the quickest. But now we start to spin out the threads, as you do with anybody who would be around you, who would test positive. You start to think all the crossovers that the president has spent time not only with Hope Hicks, but with Mark Meadows. Mark Meadows is spending time with Judge Amy Coney Barrett, who is spending time with senators on the Hill. So you just start to think all over Washington. Some people are very careful with distancing and masks. A lot of people get tested on a daily basis, certainly those who are around the president. So it's a very tightly controlled situation, but it just shows that, none of us is 100% protected from this thing. Nobody is in a bubble 100% of the time. We've learned a lot, obviously, about treating these things and handling these things. You may have talked with with Dr. Siegel about the fact that the president has been exposed before. There have been other people close to him, foreign dignitaries, visitors, people in the White House. So he's done hydroxychloroquine before. There's, plenty of debate about whether that's a preventative, whether it helps after fact. But we know as the commander-in-chief, he's going to have the very best, most attentive medical care and certainly every option available to him. The latest we hear tonight from him and the First Lady is that they feel good. They're going to quarantine, and we'll see.
You know what, I wonder, the president he's been doing 2 rallies a day, his presidential duties, on top of everything else, and then the stress of, I can only imagine that debate on Tuesday. I just wonder how this is going to affect and make this already, I feel like, a cluster of an election almost month. We're, 34 days out now? How is this going to change things?
Well, you have to think ahead to whether they develop, the First Lady or the President develop any symptoms or any complications. I mean, every case is totally different. Many people are completely asymptomatic. It's just going to be a wait and see, because you think about next week is the vice presidential debate. Just within another week after that is supposed to be the next presidential debate. So, I mean, that would be just hitting around, it would seem, the 14-day quarantine mark for the president. And this is so close to an election. You just have to watch all of these events that are critical to both campaigns. Yeah, you have to think about everybody who was at the debate on Tuesday night. If they're not already undergoing tests in both campaigns, they're going to be doing that now. We've been told that the former Vice President Biden and Senator Harris were undergoing regular coronavirus tests. So you have to think there's just a universe of people potentially to be impacted here. And it's so close to an election. It is a year like no other. I think we're safe in saying that.
It for sure is. And
I'm sure that his physicians will be monitoring a pulse oximeter. This is one of these guys where if you've been in a hospital, you put a pulse oximeter. This measures your oxygen level on your finger. I'm sure they're going to look at what his oxygen level is. If that's declining, there's some sense that maybe oxygen levels or some type of pneumonia early on in the lungs, basically an infection in the lungs, might precede symptoms. So they'll be looking for these sentinel signs early. Is the president becoming symptomatic? Is he at risk of becoming symptomatic because his oxygen level is really low? They'll be doing the same thing for the First Lady. So that's what vigilance looks like. To be really clear, and Haley was mentioning therapeutics, there isn't a single therapeutic that is available to prevent progression of COVID-19. The only therapeutic that works to save lives is a steroid called dexamethasone, but that's for individuals that are on ventilators, critically ill. We know that that can save lives once you're that critically ill. But there's nothing the president can take preemptively that we know can work to prevent progression of the virus and potentially causing the onset of symptoms. Nothing. Not hydroxychloroquine, nothing that he has talked about. So it's vital to understand that this is basically, there's a lot of uncertainty. Let's hope he pulls through. Let's hope nothing happens. But let's also hope he uses this opportunity to maybe actually start again when it comes to messaging and encourage everybody to be taking this virus very seriously. What I hope he doesn't do is take the next 10 days, if he remains asymptomatic, to minimize the virus. That's a concern I have, is if he remains asymptomatic, will he minimize the significance of this virus? I hope he doesn't do that.
Dr. Vingupta, wow, thank you for that. That was comprehensive. Jonathan Lemire remains with us, having made his reporting rounds. Jonathan, I'm trying to fast forward into the realm of the unknown. If campaigning were to somehow miraculously resume, think of what percentage of his argument, this takes away. This week at a lectern opposite Joe Biden on stage, he took personal credit for Big Ten football coming back. This week he repeated the false claim that in democratically run cities and states, they would reopen schools and the economy the day after the election because closing down surely must be a political act and not related to the pandemic. It's been the thrust of his message, as no one needs to remind you.
Brian, we have seen other foreign leaders contract the coronavirus. We know that others in the White House, including his national security advisor and other close aides, his son, Donald Trump Jr.'s girlfriend, have all contracted COVID-19. So we have entertained, we've had to consider the possibility that someday the President of the United States may come down with the coronavirus. We've been doing that for months. But now that it's here, it's almost unfathomable what this means. And you're right, it completely upends everything the president has said on the virus this entire time. Let's recall, of course, that he was almost a denier of the pandemic early on, that he was slow to wear a mask and now still rarely does, that he would say repeatedly that it would not affect children, that he's touted therapeutic drugs that were later proven to not be helpful and perhaps even harmful. He has time and again denied the seriousness of the pandemic, suggested that the nation was rounding the corner and in its last legs with this, battling this virus, flying in the face of science, and been wrong over and over. And now, of course, he has contracted it. And the questions are, what comes next? Will he actually fall ill and develop symptoms? As been discussed by the excellent medical guests, he is in a very high-risk demographic, being in his 70s and overweight. Will he, perhaps, if he does shake it off, downplay its severity, which of course would be very dangerous indeed? You know, does he attempt to resume campaigning once this period is over, assuming he does make a recovery? What does that look like? Are his supporters still going to want to hear him talk about the virus after he had just contracted it? Could there be another presidential debate? That remains highly unknown and potentially unlikely, considering what we have seen. You know, there is going to have to be a massive contact tracing effort done among White House staff, among other officials that the president has come into contact with. I'll mention just one or two now. He, of course, just a few days ago, spent time with his Supreme Court nominee, Justice Amy Coney Barrett. His chief of staff, Mark Meadows, who of course is in very close contact with the president all the time, also, much more recently, just in the last day or so, spent time with Justice Barrett, potentially Justice Barrett, with Judge Barrett. Will they now also need to quarantine? If so, what happens to Supreme Court hearings? Do those get postponed? Is that still going to possibly happen, rushed through before the election? You know, what will we have any sort of semblance of regular campaign events the rest of the way? These are things we simply don't know and won't know for a while. What we do know, Brian, as a final point, the president has indeed canceled all of his campaign travel tomorrow. His trip to Florida is off. His fundraiser in Washington is off. The one event that does remain, he's still going to have from the White House residence now, a call with vulnerable COVID-19 seniors, of course, which he is now one. He has contracted the virus. Beyond that, remains to be seen. But we have certainly stepped into the unknown here, Brian. It's safe to say this. We have never been here before.
No, we haven't. And safe to repeat something we said earlier in our coverage, the whole world is watching. And the whole world, of course, has paid.
Winds are very light. Tomorrow is going.
Wasn't that long. They stood far enough apart from each other, but who knows? I mean, we're dealing with the leaders of the country here, and I think they have to be very, very careful. So, I'm sure there's lots of considerations going on right now, but if they were to be treated according to CDC guidelines, according to how other people would be treated, then the President, the First Lady, anyone who is positive would clearly be isolated. One could have already made the argument that the President would have needed to be quarantined just on the fact that Hope Hicks had tested positive, but now clearly needs to be isolated, which is a term for someone who is positive, and then people who have had that contact, including the current Vice President, may need to be quarantined, which is the term for people who aren't positive but are suspicious. And that would be following health protocols. But Don, I guess the point you're making, there have not been a lot of the basic public health protocols that have been followed in terms of masking and things like that already. So I'll be very curious to see how they carry this forth. I mean, this is, they need to take this seriously.
Well, as I said, as I've been saying, there are so many unknowns at this moment. The president's doctor is saying, well, the president's going to carry out his duties without disruption while recovering. Well, we don't know that for sure yet. We'll have to see, you know, how the president feels, if that is indeed part of the protocol of the government, because, you know, at some point the vice president is supposed to take over if the president can't carry out his duties in any way, or if he's incapacitated. I'm not sure if the president will be incapacitated. It seems to, from the doctor's note to memorandum, that it indicates that the president is feeling okay. But my question is, as you said, there are so many unknowns. My question is, the former vice president, you believe that when they were on that stage just a couple of days ago, that they were far enough apart that the former Vice President Joe Biden should not be concerned? Or should he be concerned? Should he be tested?
He should absolutely be tested. There's no question about it. I mean, I know that they were following these protocols when they were doing this debate. I don't know exactly how far apart they were, and you got to keep in mind this is not an exact science here, Don. You know,
but Sanjay, members of the president's family and his staff sat there in that debate with no masks. I think the First Lady is the only one who wore a mask. I mean, come on.
Yeah, no, look, these events have been concerning to me from the start. You know, I mean, I think this has always been about, let's see what we can get away with, right? I mean, whether it was that debate in terms of actually having people indoors for a period of time like that. There's data now on the fact that this virus, by the way, people are wearing masks so that they don't put virus into the air, right? So when First Lady Melania Trump's wearing a mask, in part, really, when I think of that, I think that she's doing that to protect the people around her. May offer her some protection as well, but this is part of the whole debate on masks again.
Yeah,
she was wearing it to help protect people around her.
Yeah. Sanjay, I want you to...
The president may have already been exposed at that point. We don't know when he was exposed, you know, and now he may just not be testing positive.
Stand by, Sanjay. I want to bring Caitlin Collins in. Caitlin, let me ask you this. This is an updated daily guidance and press schedule for Friday, October 2nd, 2020. This is from the White House. It is indicating here that at 10 a.m. the president is still going to have in-house pool call time. And at 12:15 p.m. the president hosts a call on COVID-19 support to vulnerable seniors. Now, he was supposed to go to Florida. He was supposed to do different events. That is not on this new schedule. It says closed press after the 12:15 event. But it seems like he's still going to try to get some work in tomorrow.
Yeah, and it'll be interesting to see if they continue to put things like that on the president's schedule moving forward. Notice it says it's closed press. There's a bit of irony that it is a call on COVID-19 support for vulnerable seniors. And that is the only thing that is going to remain on the president's schedule. And that reminds me of what's at the end of the doctor's letter from the president's physician that says he is going to continue to fulfill his presidential duties. But of course, the question is, what are those duties going to look like, and what happens if his staff is having to quarantine as well, given the fact that they have been around him? His chief of staff, Mark Meadows, is one of them who has been obviously constantly around the president as he was getting ready for the debate. But Don, he's also been on Capitol Hill with the Supreme Court nominee, Amy Coney Barrett. And I think we have a picture to show you just how many levels of power are going to be involved in this and may potentially have to quarantine. There you see it. Senate Majority Leader Mitch McConnell on the right, the Supreme Court nominee in the center, and then on the left you see the president's three top aides, the Vice President Mike Pence, Mark Meadows, and the guy on the left in the red tie is the White House counsel, Pat Cipollone. These are all massive power players that have all been around the president and Hope Hicks, and now both of them have tested positive for coronavirus. So the question of what the power in Washington is going to look like over the next few weeks as we figure out how severe the president's diagnosis is going to be and how widespread this really is among his circle is just to be determined. We do not know the depth of it. We are going to have to wait to find out. That's something that we'll just have to learn in the coming days. But it's going to raise a lot of questions about the campaign as well and the future of that, because I heard Brian saying it's 13 days away is the next presidential debate. Obviously, that is shorter than the 14-day quarantine period that happens. There are still questions about how the president will be tested, when they will decide he's cleared from coronavirus, and really how the next 2 weeks look for him. If he does develop symptoms, if he does not just start to feel well, like his doctor says he does today. And that raises questions about Joe Biden's campaign too, Dawn, and whether or not he's going to suspend his campaign. We're thinking back, someone much smarter than me pointed out tonight that back in 1912, when Teddy Roosevelt had been an assassination attempt, Woodrow Wilson suspended his campaign and waited for him to recover. So is this a situation like that, where the Biden campaign takes a step like that? Do they continue campaigning over the next few weeks, knowing that the president can't? We are in a critical time frame. It was already basically a pressure cooker inside the Trump campaign, and now this diagnosis is their worst nightmare, Dawn.
Yeah, and this is, listen, this is, again, so many unknowns. Sanjay, I'm going to ask you, because you're the doctor. You saw the photograph that Caitlin made us aware of. You see Mitch McConnell, you see Mark Meadows, you see the vice president, and you see Amy Coney Barrett, right? So she's there, the hearings are supposed to start. Are they going to have to be postponed now? Is she going to have to quarantine? Because the vice president, admittedly on camera, saying that he was in the Oval Office, he met with the president on Tuesday.
Yeah, I mean, so this is concerning. This is very concerning, obviously, and there's going to need to be significant contact tracing, a word that we don't talk about nearly enough because it's impossible really in this country to contact trace 40,000 people a day. But here you have a situation, and Caitlin's putting up this photograph, where this is the kind of thing that people are going to look at and say, well, what were the various contacts now between people? Strictly speaking, we're really talking about the idea of quarantining people who've come in contact with someone with known COVID. Now, if Vice President Pence was in the Oval Office but does not have known COVID, then she may technically not need to be quarantined. I'm talking about Amy Coney Barrett now. But this is going to be a tangled web, and it's going to be challenging. And this is why you don't want to be doing these sorts of meetings indoors, close contact in the middle of a pandemic. I mean, nobody likes the situation that we're in right now, but that's one of the things that people had to have been cautious about. So it's going to, you know, and the vice president gets tested on a daily basis as well, so that's going to be something that they need to monitor very, very carefully. But there are specifics here, and again, it's not an exact science, but what is a contact? That's going to be really important. How close were you? Did you shake hands? Did you give a hug? You know, even a quick one. Were people wearing masks around? How long was the contact? Was it over 10 or 15 minutes? That's going to constitute a close contact. Was it indoors? We can see that it was indoors. They may even go back now, look at these buildings and say, well, what was the ventilation like in there? Was it poorly ventilated? Was the virus likely to aerosolize into that space? What about these spaces now, including the West Wing, the Oval Office? What sort of decontamination procedures have been ongoing? What are going to be ongoing now because of what we've just seen? So, and in the other buildings, like the picture that Caitlin is showing, those types of buildings, how are they going to be, disinfected? So all of that, I'm sure, are parts of the discussions. One thing I have to say is I hope that there is full transparency around this. Full transparency, not only in terms of who likely was exposed, but also on the symptoms that the president, the first lady, others may or may not be having, because that's going to be really, really critically important. I will say again that it's unsettling, but still the odds are very much that the president will recover from this, that will be okay from this. He is far more likely than someone who is much younger to become sick. He's far more likely because of his pre-existing conditions of obesity and heart disease, but still, much greater than 90% chance of having a recovery from this.
Yeah, we certainly hope he does recover. Sanjay, why don't you stand by? Let's bring back in.
I just got to ask. I'll take that.
Okay, that's not challenging. Next.
We all know that movement is like medicine.
I'll tell you what I've seen, and usually in the circumstances where we are, everyone is very disciplined about mask wearing. There are dispensers everywhere for hand sanitizing, and you do keep your distance. Don't kid yourself. If you're at home and you're thinking, oh, as soon as the cameras are off, they're like, hey, mask off, and we're chumming around. It's a lot more serious than that. But I've also observed the president in some of these larger circumstances go without a mask, and the thinking being, we're outside, or I have plenty of distance, and therefore I'm not terribly worried about it. What's really concerning in this particular case is if it happened to Hope and it ended up perhaps on Air Force One, how many other people were potentially exposed to it, and then ultimately that may have been the costly factor. Again, that's complete speculation. I don't know for certain, but I do know this. When I'm at the complex, everyone does take it fairly seriously. I mean, unless you are in by yourself, away from everybody, you're going to have your mask on. We're always washing our hands, and certainly in the Fox booth. I mean, we're just like that anyway. But I can tell you, even anecdotally, when I'm on the upper floors, people do take it very seriously.
And I know we've all said it, we've all heard it, 1,000 times. If you're outside, you have a lesser risk of catching this virus. He's been doing a lot of rallies. They've all been outside. I'm just curious if, anyone who's been to those, they're still pretty tightly packed in those. I know I've seen you at a couple of the rallies here lately. Are there any people wearing masks outside, or is everyone just kind of, once they get outside, it's kind of a free-for-all? Especially, even at the White House, are they wearing them outside too?
The honest answer is it's a free-for-all. I mean, people, if you are of a mindset, and I think maybe it depends on your community. In Washington, D.C., people take it very seriously. We mask up. But I have been to some rallies, some outdoor events where the feeling is I'm outdoors. It's highly unlikely that in this environment I'm going to get COVID. That's the feeling among many people. And so many of them will not wear a mask. So they'll wear it long enough to get into a particular facility, and then as soon as they don't have to, they take it off. And I've even remarked, I don't know if you observed this too, you go out to eat, you can walk into a restaurant and you have to have a mask to walk in, but while you're eating, you can take it down. So I think there's a little bit of that. There's probably, I would say, more than half the people I saw at the last rally. You may have seen me up in Ohio even after the debates. Just, again, watching people as they're around in large groups. Most people, when they're outside, in my circumstance, are not wearing masks. However, when I cover the White House events and we are obviously sort of corralled all together, more often than not, everybody does mask up.
Right, and I will just mention that even during the debate on Tuesday, the president said, I have no issue wearing a mask. He even pulled it out of his suit jacket, and a lot of the video that we've played, on loop, obviously, right here, has shown him wearing a mask. Hope Hicks is very adamant about wearing a mask, so you just wonder, obviously they came into close contact, potentially on the planes and the helicopter, but she was wearing a mask. It's just something to point out.
She was wearing a mask, and I heard the president in his conversation with Sean Hannity overnight make the comment that, when you're out there and you're wanting to be very available and accessible to so many of the women and men in uniform and local law enforcement and first responders, there may be more, again, close-quartered contact than maybe you would otherwise get. And that's a risk that all of us take anytime we go to a large-scale event. But I would say this, at least based on the conversation that he had with Sean Hannity, he sounded optimistic. You've read the tweets. I've read the tweet. First Lady even, not terribly long ago, said the president and I are quarantining at home after testing positive for COVID-19. We're feeling good, she wrote, and I have postponed all upcoming engagements. As long as they say they feel good and they're working with their doctors, I think, at least again, based on your conversations that you've had with healthcare professionals and everything that we know so far, they should be in good shape.
And then, Kevin, just really quickly, I just saw this come in. The stock futures are taking a plunge. The Dow futures are more than 400 points down after this news. Obviously, people are going to be very concerned about this, especially with, you could say, the climate of this campaign season.
Yeah, if I could just add very quickly, and I don't want to get off on a tangent here, but I just want to remind everyone, even though we all recognize we're in a hyper-political environment, be careful out there in how you consume the news over the next 24 to 48 hours. I think you want to not just be careful in how you understand what's going on and what will happen for both the First Lady and the President moving forward with respect to testing and with respect to how they're handling their quarantine and any therapies or therapeutics that they may be happen to take. But also be careful in how you listen and absorb what other people are saying. There'll be snark, I get that. This is 2020.
Right.
But again, I would implore all Americans to take a step back for just a second. These are real life situations, real people, and they're important people for our country, and we all should hope that they would recover fully.
Right, you would hope and pray that people would take this seriously, him being the commander-in-chief, no doubt. Kevin, thank you so much for joining us tonight. I appreciate it.
My pleasure.
Joining us now is Dr. Mark Siegel, Fox News and medical correspondent.
There is going to be disruptions, right? Like he can't, like the travel, for example, his schedule tomorrow has already changed, although he is still holding that phone call to talk about COVID with vulnerable seniors, that population of which he is now a part, at least for somebody who has COVID, a senior with a positive test for COVID. But at this point, there are going to have to be some changes as to how you do the work for the American people. And so these are all the threads that we're following tonight, Allie. There's a lot.
Lot of threads. Let me ask you about two specific ones, both of which you've mentioned, the Vice President and Joe Biden.
Yes.
These two people are disproportionately important at this moment in time. I have heard from you and Peter Alexander and Kristen Welker that at the White House they have sophisticated contact tracing for anyone who ends up with coronavirus. What do we know? And maybe we know nothing, but this is Thursday night. On Tuesday night, the president was in proximity, talking in a loud voice near Joe Biden. I don't know if they got any closer than they looked to be on the screen, and that might be enough space. What do we know about that, and what do we know about the last time the president was with the vice president? I found it strange that they weren't offering that information up about whether the vice president's been tested or symptomatic or what's going on. So what have you, about these two men, what have we been able to piece together?
Okay, and I'm going to get on my phone here, too, because I have some of this information for you in my notes, and I want to make sure to get it right. Let me start with Joe Biden here. As of this point, and also let me check my email, too, to make sure we haven't gotten anything from the Biden team. Nothing from Joe Biden yet on this. Now, you talk about the debate. Allie, I was, as you know, in the hall for that debate. I did not see them come closer than the podiums that they were on. There was a point at the end of the debate when Dr. Jill Biden came up and the First Lady came up as well, but the two candidates sort of stayed on either end of the stage when you talk about social distancing. What we have also heard from medical experts is that social distancing, as you know, is one piece of the puzzle and not the only piece of the puzzle. People were mostly wearing masks in the audience, although, as we noted, some members of the Trump family, obviously the candidates themselves, were allowed to not wear masks. The moderator was allowed to not wear a mask as well. So it is a question mark of how the Biden campaign is going to be grappling with this moving forward. It's a campaign that has been extremely cautious in coronavirus precautions. Only recently have they put the former vice president out to do some travel. That had been set for him even this week, with the travel to the debate and a couple of other campaign stops. He did that whistle-stop train tour through Ohio and Pennsylvania, those two battleground states as well. But the campaign overall had really tried to, the Biden campaign this is, stay away from things that were potentially risky. Only today, Allie, did they start up again this door knock campaign, going door to door. They had been doing, and I talked to a campaign official on the Biden side about this earlier this evening, they had been, before all this news broke, they had been doing, virtual conversations, trying to connect with voters that way because of the potential risk from the coronavirus pandemic. So that's sort of the Biden campaign side. On the vice president's side, the two of them had, we know that the vice president was at the White House earlier this week for a coronavirus task force meeting. What we don't know is if the president popped into that meeting. That's something that we're trying to find out. But the vice president today was actually on the road. He was out in Iowa. He returned back to Washington actually right around the time that the president was getting ready to go on Sean Hannity and say that, we had been tested and we'll see what happens, and was talking about Hope Hicks prior to the tweet announcing that he had COVID. So that's where the vice president is now. He is home, and you saw him tweeting. At this point, there is a question of what duties does he now take on, if anything is different, versus what the president would have done. whether the vice president still feels comfortable traveling, whether that is something he is going to do. And of course, next week, that debate with Senator Kamala Harris, that is set to happen Wednesday in Salt Lake City, Allie. So I wish I had more fulsome answers for you on some of these things. Please know that we are working on them, but that's sort of, I want to be careful to just state the facts as we know them and what we know, what we can back up with our reporting, and what we're still working on reporting out.
Yeah, it's important to just stick to those facts. Hallie, give us a wave or do whatever you have to do as you get more information. I'll come right back to you. Hallie Jackson for us in Washington. Joining us now, again, he's been with us for much of the evening, Dr. Vin Gupta. He's a pulmonologist and an affiliate assistant professor with the University of Washington's Department of Health Metrics Sciences. Remember, a lot of the information and the projections and the tallies that we're getting having to do with coronavirus come from where Dr. Gupta is. Dr. Gupta, you've been with us for a few hours now tonight. You've had a chance to digest this information, the news that a president who has flouted the rules about these things, mimicked them as recently as Tuesday night on the debate stage, has now got coronavirus. He makes him one of a handful of world leaders who have now come down with coronavirus. What do you make of it?
Well, first, Ali, it's good to see you. First, I hope he, the First Lady, Hope Hicks, and anybody else in their orbit that might have been exposed remains healthy. And it sounds like, at least in the case of the President and the First Lady, they're asymptomatic right now. I hope that stays the case. You know, he's our President, and I hope he remains healthy. Same for the First Lady. It would be interesting to understand what Hope Hicks is feeling right now. When we hear that she's symptomatic, what does that mean? And Ali, that's important because we think there's still so much uncertainty. We've been having conversations since March about who is truly more infectious for how long after exposure than somebody who, say, is asymptomatic. Is there a huge magnitude gap in infectiousness? If somebody has a lot of symptoms, has a fever, has a cough, has a low oxygen sat, for example, what is she feeling? And this is where I would say it's really vital. Let's forget what's happened for the last 8 months for a moment, if we can, just for the moment right now. It would be great if the White House could overshare information on what's happening with Hope Hicks. When did she develop symptoms truly? Because here's the thing, Ali. If she developed symptoms Wednesday morning, it doesn't mean she wasn't infectious Tuesday evening. There's that pre-symptomatic phase, especially in youths, where you can still be transmitting virus. We talk endlessly about asymptomatic transmission in younger people. She might have been that person. And that Tuesday night was the debate where she was, where the president was with the vice president in Cleveland. This is huge, potentially enormous in terms of the people exposed, the people that need to be vigilant, including the vice president's camp. So that's number one. Number two is everybody on Air Force One needs to be contact trace, needs to go into immediate quarantine for a period of time, regardless of what their initial test shows. So even if it shows a negative test, they need to go into quarantine because, as you know, false negatives happen all the time. So that's important. And then number three, and this is where it's just sad to see that this happened. And again, I'm glad to see that the president and the first lady are healthy at the moment. Let's hope that stays that way. But they shouldn't. Their better angels should have kicked in here. They should not have had any type of public events today or private events where others were exposed. You know, it's not a secret anymore that when they congregate, publicly or privately, they flout rules on masking and distancing. And so a lot of people at this fundraiser were exposed. They also, for the benefit of their own health and their family's health, need to go into contact tracing mode, need to go into quarantining mode for a period of time. And here's the final thing, and I'll stop talking after this, Aldi. The CDC recommends high-risk exposures, even if you have a negative test. In the president's case, it doesn't really matter. He's positive. He needs to do the 14 days regardless and reassess. But say a bunch of the other individuals on Air Force One, say a handful of them turned out negative. They had a negative test. It doesn't mean they're clear. It does not mean they're clear. They need to still go into quarantining for 10 to 14 days per the CDC guidelines. So that's clear. So I hope they take this seriously. I hope they message appropriately.
So I just want to be clear on this. Someone who was exposed to Hope Hicks may test positive like the president did within a couple of days of exposure. Someone might not test positive until Day 12, day 13 of exposure? Is it possible?
It's certainly, absolutely. The incubation period is anywhere from 2 to 14 days.
Okay, so you're not out of the woods if you get a negative test when someone else who was on that same plane or that same trip or in that same proximity with you got a positive test. In other words, that may mean multiple tests, or it may mean quarantine and a test at the end, or it may mean quarantine for 14 days and no test, but at that point you didn't develop coronavirus.
I mean, if we're going by the book, Ali, this is what I would say. I would say this is a high-risk exposure in an enclosed environment. Everybody on that flight, 14 days quarantine, regardless of what your test shows, is what they should do, in part because they are the incumbent administration and their example matters. So if they do that, that will send a powerful message.
All right, Dr. Gupta, thank you for the time that you've been spending with us tonight. I suspect there'll be more of it. You make it very, very clear for us, and we appreciate the work that you're doing for us and the work that the University of Washington is doing. Stem.
World today impacting your campaign on Biden's part has taken a lot of precautions when it comes to the coronavirus, but right now we are still waiting to hear what their thoughts are about the fact that the president and the first lady and one of his top advisors have now tested positive for COVID-19.
Well, it's interesting because the Biden folks had said that, you know, that the vice president hadn't been able to get out on the campaign trail because he was heeding the policies of social distancing, the wearing masks, the quarantine. He had been heeding that to the guidelines, to the way that he thought it should have been, and to the way, quite frankly, the Trump administration had been saying, adhering to the rules. And the criticism has been from the right and from the president, Joe Biden is stuck in his basement. He won't get out. He's wearing a mask, whatever. Perhaps Joe Biden was doing the right thing, and it's now time for the Trump administration to take a lesson from what the Biden folks have been doing all along.
Well, the Biden campaign has been very resistant to holding these large rallies in the way that the president has. Ever since the coronavirus pandemic really halted campaigning as we know it, basically between March and early June, Biden was not out there doing public events. When he did start holding events, they're much smaller, sometimes just a dozen people maybe in the media. They've kind of started to expand a little bit of their footprint. You know, he had a rally, he had an event in Johnstown, which was a drive-in rally where people in Johnstown, Pennsylvania were able to drive up in their cars and sit around outside of their cars, distanced from other people. They really have been trying with their events to show that they are going to listen to the advice of health experts and local officials. They're very cognizant of when they travel to a state, whatever the size gathering limit is, they're very cautious about making sure that they adhere to those standards. And you had heard criticism from the president and his campaign saying that Biden isn't out there doing enough. You know, the president says there are people that show up to his events, but the Biden campaign has very intentionally and purposefully made sure that their events are adhering to those safety guidelines that have been put out there by health experts and also the local officials as well. But really, I mean, Biden has repeatedly stressed the importance of wearing masks. And you've heard, even on the debate stage, the president was mocking the former vice president for wearing masks as frequently as he does. But he has repeatedly said that this is a way to help prevent the spread of this virus and has tried to have his campaign lead by example in that way.
Yeah, and they've been doing that since the very beginning. Arlette Saenz, thank you very much. We appreciate getting more information. Please get back to us. We'll get you on the air. I want to bring in now Dr. Lena Wen and also our very own Dr. Sanjay Gupta. This is Dr. Gupta, this is a headline. We learned about this back in January. The country started locking down back in March. The President of the United States has now tested positive for coronavirus after months of downplaying this disease. 207,000 Americans have died from this disease. Hours ago, he said that we were at the end of this pandemic, and here we are with the President of the United States and the First Lady and a member of his staff that we know of now, all testing positive for coronavirus. What a moment.
Yeah. Sorry, I didn't know which doctor you were talking to, but I'll take that. Yeah, welcome, Dr. Wen. Good morning. Yeah, no, it is very unsettling. It is stunning, and I also have to say it's not surprising for a couple of reasons. One is, this is a very contagious virus, okay, and the virus doesn't care. The virus doesn't care who you are, doesn't care where you are. It just likes to jump from host to host. But it's also not surprising because it's still stunning to me, I'm sure to Lena as well, that in the highest office in the land, physically, I'm talking about, the West Wing, the Oval Office, that there weren't some of the basic precautions being taken place. The precautions that we talk about from a public health standpoint aren't foolproof. They're not, a panacea, but they could have gone a long way towards curbing the spread of this. And as you were just pointing out, along with Brian and Caitlin and everybody, that there was still a very lax attitude towards this virus within close quarters, close contacts for people that were having meetings, prolonged meetings, all these types of things. That was always a concern. And I think for a lot of people, it was thinking, you're really tempting fate here. With allowing this to continue to go on, especially in an unmasked sort of way. So it's again very unsettling for people to wake up to this news. Statistically, the president is still likely to have a full recovery from this, very likely to have a full recovery. But this was I would dare say it was preventable. What we're seeing right now. Testing doesn't prevent the disease. Testing tells you now have it. People kept saying, well, he's getting tested every day. Well, that's not the point, really. Testing is important because then you can isolate people, but testing doesn't prevent people from developing the disease if they're still not abiding by other public health measures.
Yeah, and that was never the point. And a lot of people confuse that, saying, well, if we just have more testing, that's not going to stop it. Well, that's not the point of the testing. Yes, it can stop it because then you find out who has it and where, and you get the spread of the coronavirus, and also where there are hot spots and so on, so it can help with containing the virus. Dr. Wen, I asked Dr. excuse me, good morning to you, and thanks for joining us. When last I spoke to you, it was evening. So I asked Dr. Gupta if he thought this was a reckoning. I think a better question is this an opportunity, considering the First Lady says she feels okay, the President says he feels okay, we're understanding that Hope Hicks is suffering from suffering symptoms, but is thought that she's going to be okay. Is this an opportunity for the president now to correct course, and to get people to get on board, and to now take it seriously, to tell people to wear masks, to tell people to social distance, to tell people maybe it's not such a good idea to open up all sections of the economy right now, to send all children back to school, that people should not be out hanging in bars and drinking where they won't social distance? Is this an opportunity to have more buy-in from the American public, and that will actually put our economy and the health of the country back on track?
I really hope so, Don, but backing up for a moment, it is going to take time for us to see what's going to happen with the President and First Lady. And of course, I am praying for them and thinking about them as well and hope that they will have a full recovery. But it's going to take time. It's going to take maybe a week or so before they may develop symptoms. And if people were to develop symptoms, between the time they develop symptoms and between the time that they get very ill, we're talking about another week or 2 weeks after that. So we are going to be waiting for a while to see what happens with the President of the United States. But to your point, I hope that this is an opportunity that all of us as Americans will be taking, because we have known for a long time now what it takes for us to prevent this disease. But we've also let our guard down. And in some ways, it's understandable because of quarantine fatigue, also understandable because I think it's hard for us psychologically to think about people we love, our family and friends, as having coronavirus. But there's no face of someone who could have coronavirus. And I think as we're finding out tonight, the president himself could have coronavirus. And maybe that should be a reckoning for all of us to pay attention to this extremely contagious and very serious disease.
What is your advice if you were advising the White House, let's just say you were one of the people who had the president's ear, what would you tell
Well, I would tell the president to be upfront with the American people. I would ask him to give an address directly to the American people and explain about exactly what he is going through. I think this is a moment that he could be connecting with the millions of Americans who have had coronavirus and talk to them. And also it's an opportunity for him to talk to the American people and explain to them how we can take precautions, we can take matters into our own hands and prevent one another from getting this extremely contagious disease. It's an opportunity to turn things around the way that I really wish the president had done months ago in terms of having a national strategy. But this is a personal moment that he could connect with the American people and help to save many more lives potentially.
All right, doctor, stand by. I want to get back to CNN's Caitlin Collins now. Caitlin, listen, we got the news earlier. Your sources, I had a source as well, telling us about Hope Hicks, that she had tested positive, and we're trying to figure out what's going to happen from there. She was in close contact with the president then admitting that he had heard about it and that he and the First Lady had been tested and they were awaiting their test results. Now we're learning that the President of the United States and the First Lady have both now tested positive for the coronavirus. Again, so many unknowns. We don't know what's going to happen tomorrow when the sun comes up in Washington.
Which is going to be in just a few hours from now, Don. But we're also learning more about how this has transpired, and there are going to be a lot of things that the White House has to answer for, because what we have just learned from sources that I've been speaking with over the last hour or so is that there was a small group of officials inside the White House that Thursday morning knew that Hope Hicks was ill and that she had tested positive for coronavirus. Despite knowing that and knowing that she was someone who was around senior staff on Wednesday, a very late night trip, and around the president still went to New Jersey yesterday for a closed door fundraiser that was inside, despite knowing that he had spent several hours previously on a plane with someone who had tested positive for coronavirus. The other thing that means is that Kayleigh McEnany, the press secretary, was also in close contact with Hicks, yet despite that did not inform reporters today and instead held a press briefing at the White House where she came into the room not wearing a mask and briefed reporters for about 25 minutes, I think is how long the briefing lasted. But of course, as is their style, the White House press secretary and her staff, they do not wear a mask when they're in the room. The White House reporters do wear a mask when they are in the room asking questions of the press secretary. So the question is going to be for the White House, why did the president still go to New Jersey knowing that he could potentially put these people at risk, these people, these donors and fundraisers that he was sitting with at this roundtable today? And of course, why did the press secretary still hold a briefing despite knowing that she had come into contact with someone who had tested positive for coronavirus? And just saying that she had gotten a coronavirus test, she didn't even tell us, didn't even tell the reporters who were on the plane, didn't disclose any of that. And there are going to be serious questions about the White House keeping that information, not just from the reporters in the room, but also from the American people about the state of the health of the president and the people that he potentially came into contact with.
So Caitlin, just real quick here, if this had not leaked or the media had not found out about it, or as he likes to say the fake news media, which is, you know, not because we're reporting it, it's not fake, might we have not known about this or heard about it much later?
I think we would have found out eventually. I think it would have been impossible for this White House to have a president who tested positive and not tell anyone. But you have to look at the timing here, because the way the president was speaking to Sean Hannity tonight, he said that he had just been tested. That was around 9 o'clock, about an hour after the story had broken, and said they were waiting on their results. So you have to question, how rigorously are they testing the president? Is it actually on a daily basis? And if they had not tested him tonight, knowing that the public was well aware a top aide had tested positive, what if they had waited another day, Don? What if they had waited until tomorrow before he was going to Orlando, and then the president had still been around his family, other aides, other staffers? There are staffers who work in the residence of the White House, we should note. It's not just people who work in the West Wing and are political focused. There are staffers who work and serve the president and the First Family in the residence. So it raises questions about those people, about the Secret Service agents who protect the president and obviously are in close proximity with him. It raises so many questions about the people who potentially could have been put at risk because of this and because of a lack of information and being forthcoming coming from the White House until the president himself decided to tweet out his diagnosis.
And there were reporters who were traveling with the president on Air Force One, and they didn't know until they heard the news. So I mean, it's just unbelievable. Caitlin, I want you to stand by. I want everyone to stand.
When the second set, your doctors, in-home aides, home delivered
more information that we have access to, such as the degree of the viral load, I'm confident they'll be making better decisions. You know, we're seeing the mortality overall come down. Look at Europe, 47,000 cases to 77,000 cases each day. They're going through what might be a second wave. They're not seeing an increase in mortality, nothing like they did in the first wave. It may be because viral load matters. It may be because when people use some distancing and there is masking in indoor areas, as we know is true around the president and has been for some time now, then we know the viral load is a lot less. And maybe that lower viral load is the reason we're seeing a lower mortality.
Right, and I want to go back to you know, the whole wearing a mask conversation. A lot of people say just wear the mask, you'll be fine. I swear I've heard that 1,000 times. Here recently, we have seen the president wearing a mask. Hope Hicks was adamant about wearing a mask, but there's still, you know, the issue of the touching and the sneezing and the coughing. So there's the droplets. How effective is the mask as far as, you know, preventing someone from getting this? Because, like, even there on the screen, we see him wearing a mask, typically distant, you know, from people around him. But that's a question that I have as far as the mask wearing and how effective that could be or not.
Good question. The masks help, but they're certainly not perfect. And they've actually measured the amount of virus that can be transmitted with different types of masks. And with a really good mask, it can be, you know, 90% effective as a deterrent. And with a poor mask, it could be 15 or 16% effective as a deterrent.
And I don't mean to interrupt, but what is your idea of a good mask and a bad mask? I see people with all kinds of things around their faces. What is a good mask considered?
So there's generally 3 levels of masks. Now, the best mask is an N95 mask, and you want to make sure you don't have a two-way valve, so you can breathe. Some of those industrial N95 masks allow you to breathe the virus out, and because, you know, it's not designed to filter what you breathe out. So, but an N95 with a one-way valve is the most effective. The next is a surgical mask, and we commonly refer to the benchmark of a level 3 surgical mask. And the least effective is a light cloth, and you typically see those with something like a gaiter.
Right, and as far as the rallies that have been held outside, is that anything for people to worry about? Because he's been doing 2 rallies a night. Obviously, they're socially distant from the president, but there's always, you know, when someone especially high profile as the president comes down with this, you know, people have got to wonder if they have anything to be worried about.
Well, generally speaking, the outdoors is much safer. There was a study in Asia of 33 outbreaks, and 2 potentially involved some outdoor settings. So we know that by and large, super spreading events and outbreaks are driven by indoor activities. Now, we know there's a lot of factors like whether or not the wind is blowing. The indoor equivalent is what's the quality of the ventilation. Why do you think bars got scrutinized so much? Because they notoriously have poor indoor ventilation, people talking for a prolonged period of time at a high volume. And so you think of all of the air that somebody exhales, if that accumulates and it's increased by the volume and the length of speaking, then that's essentially emitting sort of a cloud of aerosolized virus if somebody's infected. So generally speaking, we've been encouraging outdoor activities. We don't want people hugging. We don't want people too close to each other if they're shouting and screaming. You know, in sports events, we've been encouraging some distancing. Outdoors is still relatively safe, and I'd encourage people to be outdoors. But if you notice, the president, even at these rallies, has not been shaking hands, has not been hugging people, and that's been a protocol for some time now. That's why I think if the president truly has a virus in his system now, if that test that was positive truly was an accurate positive, he probably has a low viral load, and that's good for prognosis.
And going back to this incubation period, just for those who were just now joining us, the president has tested positive, as well as the First Lady Melania Trump, for COVID-19. This incubation period, what we were talking about, So say the president is symptom-free essentially the whole time. He tests negative. Is there a certain amount of tests that he has to have a negative test for in order to be considered clear of COVID? And is it a particular type of test that it's going to take to clear him, or is the rapid just as good as the nasal? How does that work?
Great question, Ashley. So here's how you get cleared. If you have symptoms, you are cleared 10 days after the onset of symptoms and about 48 hours of having no symptoms. And we know you're most contagious on the front end and not on the tail end of the infection when you have symptoms. Some people like to see 2 negative tests using a PCR test. The sensitivity on those PCR tests ranges from about 85 to 93%. The new Abbott test is a little more sensitive, and that just got announced, and the government ordered $150 million to distribute to states and to nursing homes and to healthcare facilities. If you don't have symptoms, though, at all, we know the incubation period is 1 to 14 days, so we tell people to wait 14 days before they're essentially clear. The average time to symptoms is 6 days. So I think if the president does not develop symptoms, it may be a 14-day quarantine unless 2 tests come back positive in sequence. Then his doctor may have the confidence to say, you're clear to be out there, and of course to continue to use precautions.
And then if you look at the video on the screen right now of the president and Hope Hicks, and you know, I'm guilty of it myself. People, when they talk, they'll pull the mask down just a little bit below their nose, just almost to take a breather, if you will. Is this, you know, a bad thing to do, because once again you're touching things, and we keep going back to you got to keep your hands clean, don't touch anything, the sneezing, the coughing. So is this something that people need to be aware of? And if you are going to wear a mask, hopefully a good mask, as you were saying, you know, a tier 3 mask, is this something people should, you know, steer clear of doing?
Well, first of all, I get it. There's mask fatigue, there's public health precaution fatigue, and people get different impressions of the severity or threat of this infection based on who they know, what they saw happen last, or a statistic or study that just came out. It is important for people to remember that this still is a very contagious and deadly virus, and that 2 days ago we had over 900 Americans die from this virus. So just because it's not getting coverage doesn't mean it's still not out there. Just like the opioid crisis, just because we don't talk about it doesn't mean people are still not dying. But I am very optimistic on the president's prognosis for a lot of reasons. We have knocked down the case fatality rate from this infection to almost seasonal flu levels in some populations. And then you add another therapeutic that could be announced any day now, say the monoclonal antibodies, the monoclonal cocktail by Regeneron, and some other therapies. It may be that the case fatality rate could be reduced to seasonal flu levels. It's still contagious, still something people need to pay attention to. And Ashley, I don't want to say there's 2 sets of rules, but certainly if one thing we've learned is that if somebody has the metabolic syndrome, any combination of hypertension, obesity, and prediabetes or diabetes and high cholesterol, those individuals are at highest risk. Along with kidney disease, that appears to be the highest risk population. And if you're in that high-risk group, that's when you should really take extra precautions, right? That's when being indoors for a prolonged period of time means that you need to really strictly abide by all the guidelines to the letter of the law.
All right, Doctor, thanks so much for being up with us late tonight on this news. We really appreciate it.
Thank you, Ashley.
No problem. And now we're going to join in Fox's Griff Jenkins in the D.C. Bureau. Hey, Griff.
Hey, Ashley, good morning. I think most of Washington's press corps has been woken up by now with the stunning news that the president and first lady have tested positive for the coronavirus. This news coming just 32 days before the election. The news having far-reaching implications, not just from the president's health, but also the administration's response to the pandemic. The president often not wearing a mask. In recent speeches speeches and rallies saying that we are turning a corner, and of course the news coming just hours after his longtime trusted aide Hope Hicks tests positive. As we know, everyone who comes into close contact with the president is tested on a near daily basis. That news is very significant because we know that Hope Hicks was with the president as recent as Wednesday at that rally in Minnesota. She was also at the debate in Cleveland on Tuesday, and before that, the weekend rally in Pennsylvania on Saturday. She was there. Also, some news coming from our correspondent Peter Ducey that the chief of staff, Mark Meadows, has tested negative, a positive sign, but ultimately, really, we're just waking up here in the middle of the night at just before 2:45 a.m., trying to piece together exactly what this will mean. The president tweeting out that he and the First Lady have tested positive and that they will begin their quarantine and recovery process immediately. So he will be at the White House, not at what was scheduled to be a number of events, including a fundraiser this evening tonight in Florida. This all now breaking at this moment, and it's not
defining insurance.
Robinhood believes now is the time to do money without the commission.
Brian, let me ask you, and I appreciate you helping me out as well. The president has been saying at rallies, making fun of what's happening with this, saying just a couple of hours ago that we're at the end of this pandemic. And you sent me a note saying that he said what, just 10 days ago?
10 days ago, he said, this affects virtually nobody. He was arguing that most people who get the coronavirus don't really feel it, don't really suffer, and they just recover quickly. Now, we know that's contrary to the evidence. We also know that many people who get sick with COVID feel it for a very long time. I was thinking about my friend Sarah, who was sick in March and was suffering still in June. All of us, Don, have friends or family members who have contracted this disease and know what it's really like. So that's what's made the president's downplaying and denialism so disturbing in recent months. Now, of course, there's no way to deny this anymore. The entire government is on alert, the military is on alert, everybody's on alert. And quoting the New York Times overnight, Don, what happens if the president actually becomes sick? What if he's symptomatic? What if he is bedridden? Quote, it could raise questions about whether he should remain on the ballot at all. That's Maggie Haberman and Peter Baker this morning in the New York Times. Just to give us a sense of the stakes, Carl was saying earlier, no one knows what happens next. It's October 2nd.
Debates?
And we don't know what happens next.
Listen, again, let's hope that the president's going to be okay. But what about you? Think
the odds are in his favor, and that's important to say.
Yeah, but
and this will be a lesson for the country. But
yeah, but
you
have to say what are the possibilities? We don't know what happens now, right? What are the implications? But
what I think the vice presidential debate next week. Will there be a vice presidential debate?
That's what I want to ask you. Is there going to be a vice presidential debate? Is there going to be another presidential debate? Are debates over? Are they gone?
Look, 3 hours ago, the president was going to fly to Florida on Friday for a political event. He was scheduled to be in a crowd in the coming hours. Of course, that's been canceled. His calendar's been canceled. Oh, sorry, Wisconsin. That's right.
Wisconsin and Florida. Yeah.
The idea that he was going to be traveling, even though he knew that Hope Hicks was testing positive, is disturbing, and it speaks to dysfunction at the White House that they weren't more quickly taking action to try to figure out who was sick and what the president should do about it. So those are questions for Friday morning, Don, about why there wasn't faster action taken. As to the debates, right now I'm thinking we're not going to have debates, but again, who the heck knows?
Yeah, we don't know. So many unknowns. I keep saying that, Sanjay, so many unknowns.
Now, really, that it's part of this incredible scenario where the president of the United States has tested positive as a senior citizen at 74 for this virus. I've been reaching out to the vice president's office. I know that you have reporters at NBC News and MSNBC who have been doing the same, and it's just not clear whether or not the vice president, who of course works often closely to the president, whether or not his status for the coronavirus is known. It's going to be clear that he's going to have to likely be tested. He is, of course, the next person in line if anything even gets hairy with President Trump in terms of this virus. We've said it before, and I think it's important to point it out again, that the president is in a high-risk category, and according to the CDC guidelines, he should be quarantining for at least 14 days. So this really, even though the White House House doctor says this is not going to disrupt his schedule. This, of course, is going to disrupt his schedule. He's already canceled a trip to Florida and now is going to be hosting this call. But to your question, in the United States right now, we're now looking at who's next in line and what are the people who are next in line, how are their health? And what we don't know, the big question that we don't have right now, the answer that we don't have is, what is the vice president's status?
Yamiche, there is the irony of this, because one never wants to take any pleasure in the misfortune of others, the illness of others, and the danger of this remarkably serious disease that has killed more than 200,000 Americans. But there are those who are hoping that this is an opportunity for President Trump to change his views on the public health advice around masking and social distancing, something that he mocked as recently as Tuesday, including mocking Vice President Joe Biden about wearing a mask. He called it the biggest mask he's ever seen. He says this guy puts his mask on even if nobody's around. You're an expert at this. Do you see any sense that things might change and that they might embrace a more logical approach to coronavirus?
Well, I think this is uncharted territory. The president, of course, said that there was going to be a miracle that did away with this virus. He's been trying to put the virus and this pandemic in the rearview mirror, saying that essentially the United States is getting through this. And now he himself has to contend with the fact that as the president of the United States, he could not protect himself from getting this virus. That's a remarkable statement. The president has been saying that he's going to keep Americans safe, and now at this point, he hasn't been able to keep himself safe, and that underscores how this virus is really infecting and touching Americans across socioeconomic lines, across gender and racial lines. The fact that the president has all of these resources is essentially the most protected American in the country. The fact that the virus could infect him, it really upends the president's argument that this virus is something that maybe it's going to be going away and not to be taken too seriously. I guess in some ways it's really hard to tell whether or not the president is going to change his tone, because just in the few minutes that this has been breaking, I've been talking to some political strategists, and there are two people. There are the people who think that the president could look at this and take this more seriously and say, look, I didn't understand how serious this virus was. Now I've had it. I know what it does to people's body. Or on the other hand, he could say, look, it was asymptomatic. This isn't as serious as they say it's going to be, and that people have been making much to do about nothing. There is that scenario that the president could use this to say, I've had this virus and people shouldn't be scared. We can envision that as someone who has covered the president, who has seen the president. But there, of course, is the other opportunity that he could, as a senior citizen, say, I did not understand how serious this virus was, and now me and my wife have suffered because of it.
Yeah. I mean, I might grow